All right. Let's dive into something that's becoming, I think, more and more relevant as our population ages, and that's heart health.
Definitely.
Specifically, we're going to kind of explore this condition called aortic stenosis
hmm
and a procedure that's been pretty groundbreaking in how we're treating it these days.
Yeah, it's a really fascinating area and one that's seen some incredible advancements even just in the last few years.
Absolutely. So first things first, what exactly is aortic stenosis? For those who might not be familiar with it, and why should we be paying attention to it?
Okay, well, imagine the aortic valve in your heart. You can think of it as a door that's controlling the blood flow from your heart out to the rest of your body.
Okay.
Aortic stenosis is essentially when that door becomes stiff and narrowed, and that makes it harder for the heart to pump blood effectively.
So it's like trying to push a lot of water through a tiny hose.
Yeah, exactly. And you can imagine that that puts a lot of strain on the heart. Over time, it can lead to symptoms like fatigue, shortness of breath, chest pain, even fainting.
That sounds pretty serious.
It can be, yeah.
How common is this, and who's most at risk for aortic stenosis?
Well, it's more common than you might think, and as we were talking about a minute ago with the aging population, the risk increases significantly with age.
Okay.
In fact, the risk of developing aortic stenosis actually doubles with each decade of life after the age of 50.
Wow. So that's that's a sobering statistic.
Yeah.
So for someone who is diagnosed with aortic stenosis, what are the treatment options?
Well, traditionally, the only option for severe aortic stenosis was open heart surgery to replace that valve.
Right.
Big procedure,
Sure.
significant recovery
I
period.
can imagine.
Um,
Thankfully, medical advancements have led to less invasive alternatives, right?
Absolutely. And that brings us to the game changer that I think we're going to be exploring in this deep dive, and that's TAVR, transcatheter aortic valve replacement.
Okay, so TVR, I've definitely heard that term kind of thrown around,
Right.
but I'm a little fuzzy on the details. Can you break it down for us? What exactly is it?
Sure. So think of TAVI as a minimally invasive way to replace the aortic valve, and you can do it without open heart surgery.
Okay.
So instead of opening up the chest, doctors insert a catheter, which is a thin, flexible tube, through a blood vessel, usually in the groin, and then they guide it up to the heart.
So they're threading this new valve all the way up to the heart through this tiny tube.
Exactly. And they use some sophisticated imaging techniques to guide that catheter and make sure they get that new valve placed precisely.
That's incredible.
It's really amazing.
It sounds like something out of the science fiction movie.
Yeah.
So, but how does this new valve actually get implanted, I guess, once it reaches the heart?
Well, there's different types of TAVR valves, but let's talk about one of the most common ones, and that's called the balloon expandable valve.
Okay.
And so once the catheter reaches the aortic valve, they'll inflate a balloon that's at the tip of the catheter, and that expands the new valve and pushes that old narrowed valve out of the way.
It's like a tiny, intricate origami project happening inside the heart.
Yeah, that's a good way to think about it.
So the new valve is in place.
hmm
The old one is pushed to slide. What happens next? Do they just remove the catheter and call it a day?
Pretty much, yeah. They'll do a thorough check to make sure the new valve is functioning the way it's supposed to and that there's no leakage. And then they just remove that catheter and the small incision in the groin is closed up.
So no major incisions, no cracking open the chest.
That's right.
This sounds too good to be true. What are the advantages of TAVR over traditional open heart surgery?
Oh, they're pretty significant. I mean, first and foremost, it's much less invasive, right?
Right.
Less pain, less scarring, and the recovery time is much faster.
Okay.
Typically, patients who undergo TAVR just spend a few days in the hospital compared to weeks with open heart surgery.
Wow, that's a huge difference.
It is.
Are there any other benefits?
Yeah, studies have shown that TAVR can be just as effective as surgery in terms of improving symptoms and quality of life. And in some cases, it's even been shown to have better outcomes than surgery, particularly for patients who are at high risk for complications from a major operation.
That's remarkable. So it's less invasive, faster recovery time, can even be more effective than surgery in some cases.
Right.
Sounds like TAVR is a real game changer for heart care.
It is, yeah.
But I imagine it's not suitable for everyone, right?
Yeah, you're absolutely right. Not everyone is a candidate for TAVR. And doctors carefully evaluate each patient's circumstances to figure out the best course of treatment.
Okay, so what are the factors that doctors consider when deciding if someone is a good fit for TAVR?
Well, a lot of factors come into play. So they're looking at the severity of the aortic stenosis, the patient's overall health, their age, other medical conditions they might have.
Right.
And they also assess the anatomy of the heart and blood vessels to make sure the procedure can be performed safely and effectively.
So it's a very individualized decision-making process.
It is, yeah. The goal is to choose the treatment option that offers the best balance of benefits and risks for each patient.
That makes sense. We've talked a lot about the positives of TAVR, but it's important to acknowledge that, like any medical procedure, there are potential risks and complications.
Of course, yeah.
So can you shed some light on those? What might they be?
Sure. So some of the potential complications can include bleeding, stroke, infection, problems with the new valve itself, things like leakage or the need for a pacemaker.
Those all sound pretty serious. How common are these complications?
Thankfully, the risks associated with TAVR have really decreased over the years as the technology and techniques have improved.
Okay.
So the vast majority of patients who undergo TAVR experience successful outcomes with minimal complications.
That's good to know. That's reassuring.
Yeah,
But it highlights the importance of having that thorough conversation with your doctor who specializes in TAVR
right.
to really understand the potential risks and benefits in your individual case.
Couldn't agree more.
Absolutely. So we've covered the basics of aortic stenosis, the ins and outs of the TAVR procedure.
Right.
We've even touched on some of the potential risks. But our deep dive into TAVR doesn't end there.
Nope.
There's so much more to explore. I think it'd be great to get into, some of the latest research, talk about the expanding use of TAVR in specific populations, and maybe even get into the future of this remarkable procedure.
Yeah, for sure. It's a fascinating field and it's constantly evolving, and I'm eager to kind of delve into some of those topics with you.
Me too. Let's take a moment to gather our thoughts, and we'll be right back.
Sounds great. Welcome back to our deep dive into TAVR. Before the break, we were discussing the benefits of TAVR over traditional open heart surgery.
Yeah, and I think it's really amazing, those benefits, to think that a procedure that was once considered high risk is now, becoming the standard option for so many patients with aortic stenosis.
It is, and what's even more exciting is that TAVR is constantly evolving. Researchers are exploring new applications and really kind of pushing the boundaries of what's possible with this procedure.
Absolutely. One area that I found really fascinating in the research was the use of TAVR for patients with bicuspid aortic valves.
Yeah.
Can you explain what that is and why it presents such a unique challenge for TAVR?
Sure. So most people have an aortic valve with 3 leaflets. You can kind of think of them as flaps that open and close to regulate that blood flow. But some people are born with a bicuspid valve, meaning it only has 2 leaflets.
Okay.
And this can make the valve more prone to narrowing and calcification, which then leads to aortic stenosis.
So it's like having a slightly different door design in the heart.
Exactly. And that different design can pose some challenges for TAVR. The uneven shape and the calcification patterns of a bicuspid valve, they can make it trickier to position the new valve correctly and ensure that there's a good, tight seal.
So it sounds like it's a more delicate procedure in those cases.
It can be, but the sources we looked at mention that TAVR is showing some promise for bicuspid valve patients.
It is. Thankfully, advancements in imaging and valve technology have made it possible to adapt TAVR for these bicuspid valves.
Yeah.
Doctors can now use, very specialized imaging techniques to get a really detailed view of the valve and all its surroundings, which allows for more precise placement of the new valve.
Yeah, it's like having this super detailed roadmap of the heart
Exactly.
to guide the procedure.
And the results have been encouraging, it seems.
They have, yeah. Studies have shown that TAVR can be just as effective for bicuspid valve patients as it is for those with the more common tricuspid valves.
That's really, it's really good news.
Yeah.
So it means that more people can potentially benefit from this less invasive approach, regardless of their heart's unique anatomy.
That's right. And speaking of expanding the reach of TAVR, the research that's being done in this field is truly groundbreaking.
Yeah, the source material we've been looking at mentions some pretty impressive studies that have really changed the way we think about TAVR.
Yeah, trials like Partner 3 and Evolute have really been game changers.
Sure.
They've shown that TAVR is not only safe and effective, but it can even be superior to traditional surgery for certain patients.
Can you remind us what some of those studies found?
Sure. So the Partner 3 trial, that focused on low-risk patients, so those who were previously considered to be good candidates for surgery.
Okay.
And it actually found that TAVR with a specific type of valve, the SAPIEN 3 valve, was actually better than surgery in terms of reducing the risk of death, stroke, or rehospitalization.
Wow. So not only is it less invasive, but it actually outperforms surgery in a head-to-head comparison.
Yeah, that was a major turning point because it challenged this long-held belief that surgery was really the gold standard for all patients.
Right.
And with TAVR, there were shorter hospital stays, fewer complications, and patients were able to get back to their normal activities much faster.
It's amazing how research can shift our understanding so much and lead to these, much better treatments. What about the EVALIT trial? What did they find?
So EVALIT looked at intermediate risk patients, and they found that TAVR was just as effective as surgery at preventing death or disabling stroke.
Okay.
And this really further solidified the idea that TAVR is a viable option for a much wider range of patients.
Absolutely. It's pretty remarkable how TAVR has gone from a high-risk procedure to this mainstream treatment option in such a short amount of time. What does all this mean for the future of aortic stenosis treatment?
I think we're seeing a real paradigm shift in how we're approaching this condition. TAVR is really becoming the preferred option for many patients, regardless of their surgical risk.
So that's a huge leap forward in heart care.
It is.
It makes you wonder, what other advancements are on the horizon for TAVR?
Well, one area that's really exciting is the development of even less invasive approaches. So, researchers are exploring ways to perform TAVR without having to access a major artery, like in the groin.
So even less invasive than what we have now. That's hard to imagine.
I know, right? One of the approaches that's being investigated is called transcatheter TAVR. And with this one, the catheter is inserted through a vein either in the neck or the leg, and then it's guided to the heart through this small puncture in the wall of the heart.
Wow, that's cutting edge.
It is, yeah.
Are there any other kind of futuristic advancements in TAVR that you're excited about?
Oh, absolutely. Another area that's really evolving rapidly is the use of artificial intelligence in TAVR.
Okay.
And so you can imagine AI algorithms that can actually analyze vast amounts of data, everything from medical images to patient records. And all of this can help doctors to make more informed decisions about things like valve selection, procedure planning, personalized risk assessment.
So AI is like like a virtual assistant in the operating room, helping to really optimize the procedure and improve the outcomes.
That's a great analogy, yeah. It really has the potential to enhance the precision, efficiency, and safety of TAVR. And I think it's going to take this already remarkable procedure to a whole other level.
It's really incredible to think how technology is transforming heart care like this.
It really is.
But even with all of these advancements, it's still important to remember that TAVR, like any medical procedure, carries some potential risks.
You're absolutely right. It's important to have a balanced perspective and understand both the benefits and the risks involved.
So let's maybe delve into those risks in a little more detail and discuss what's being done to try to mitigate them. One of the concerns that I often hear about is the risk of stroke during or after the procedure.
Yeah, stroke is definitely a serious complication that can occur with any procedure that involves accessing the heart and blood vessels.
Right. So how does stroke happen in the context of TVR?
Well, it can happen if a blood clot forms during the procedure, maybe due to the manipulation of catheters and wires within those blood vessels. And then if that clot travels to the brain, it can block blood flow and cause some damage.
That's a pretty scary thought.
Yeah.
What measures are being taken to try to minimize that risk of stroke during TVR?
Thankfully, there have been some significant advancements in stroke prevention strategies.
Okay.
So, doctors now routinely use transesophageal echocardiography, TE,
Okay.
to actually visualize the heart and aorta during the procedure, and this allows them to identify any potential sources of clots.
So it's like having a live video feed of the heart to spot any trouble before it can even happen.
Yeah, exactly. And if they do see any signs of clot formation, they can take steps immediately to either remove it or dissolve that clot before it can cause any harm. And patients are also given medications to help thin their blood and reduce the risk of clots forming in the first place.
So it's kind of a multi-pronged approach to stroke prevention.
It is, yeah.
Are there any other potential risks that we should be aware of?
Yeah, bleeding. Anytime you have to puncture a blood vessel, there's always that risk of bleeding.
Right, but I imagine the risk is lower with TAVR than with open heart surgery.
It is, yeah, and that's because TAVR doesn't involve opening the chest or stopping the heart.
Right.
Those incisions are much smaller, and there's less disruption of the tissues and the blood vessels.
Okay.
But doctors still take a lot of precautions to minimize bleeding, so they carefully monitor blood clotting factors, and they use techniques to seal that access site very effectively.
Okay, so it sounds like they're really taking all these steps to ensure patient safety.
They are.
Are there any complications that are, I guess, unique to TAVR?
Yeah, so one potential issue that can happen with TAVR is something called paravalvular leak.
Okay.
And this is when blood leaks around that new valve instead of flowing through it properly.
So how does that happen, and what are the consequences if that does occur?
So it can happen if the valve isn't positioned perfectly or if there's a calcium buildup around the valve's anchoring point, and that can prevent a tight seal.
Right.
And if it's a small leak, it might not cause any problems.
Okay.
But a larger leak can reduce how effective the valve is and could potentially lead to heart failure.
That sounds serious. Is there anything that can be done to fix a paravalvular leak if it does occur?
Yeah, in some cases, doctors can actually address it during the procedure. They can try repositioning the valve, or they might use a special balloon to expand it further and try to improve that seal.
Okay.
If it's detected later on, there are still some minimally invasive techniques that can be used to repair it.
Oh, wow. It's amazing how they can address these issues without resorting to open heart surgery.
Yeah, it really speaks to the advancements that we've seen in interventional cardiology.
For sure.
These doctors are constantly refining these techniques and developing new tools to make TAVR as safe and as effective as possible.
This has been such an insightful look into TAVR and its impact on heart care.
Yeah.
It's clear that this procedure is truly a game changer,
Yeah,
offering hope and a better quality of life to so many people worldwide.
absolutely. And as we've been talking about, the future of TAVR is full of so much promise. It's all driven by the research, the innovation, and the dedication to improving patient outcomes.
Before we wrap up this part of the deep dive, I'm curious, what are your thoughts on where TAVR is headed, the next 5, 10, even 20 years? What do you think are some of the most exciting possibilities on the horizon?
It really is an exciting time to be in this field.
It is fascinating to think about how far TAVR has come and what the future holds. Where do you see this technology headed?
It's an exciting time to be in this field, that's for sure. I think we'll continue to see TAVR expand to even lower risk patients. If it's less invasive and can achieve the same or even better outcomes than surgery, why wouldn't it become the standard of care for everyone with severe aortic stenosis?
It's a compelling argument, especially with those impressive trial results we discussed. Are there any other advancements that you find particularly promising?
Absolutely. There's a lot of research focused on making TAVR even less invasive. Imagine procedures done without the need for large incisions or even general anesthesia. We're talking about interventions that could be performed in a catheterization lab rather than an operating room, with patients going home the same day.
Wow, that sounds almost like science fiction. What would those procedures look like?
Well, one avenue being explored is transcatheter mitral valve replacement, or TMVR. It's similar to TAVR, but instead of replacing the aortic valve, it focuses on the mitral valve, which controls blood flow between different chambers of the heart.
So it's essentially applying the same principles of TAVR to a different valve.
Exactly. And just like TAVR revolutionized aortic valve treatment, TMVR has the potential to do the same for mitral valve disease. This could be life-changing for patients who currently face open heart surgery as their only option.
It's incredible to think about the possibilities. Are there any other cutting-edge advancements in TAVR that have you particularly excited?
Another area that's generating a lot of buzz is the use of artificial intelligence, or AI, in TAVR. Imagine AI algorithms that can analyze medical images, patient data, and real-time information during the procedure to guide doctors towards the best possible outcome.
So AI is like having a superpowered assistant in the operating room.
Exactly. AI can help with things like selecting the right valve size, optimizing device placement, and even personalizing risk assessments for each patient. It's about leveraging technology to make TAVR even safer, more precise, and more effective.
It sounds like AI has the potential to truly revolutionize heart care. As we wrap up this deep dive, what key takeaway would you want our listener to ponder?
TAVR is a transformative procedure that's already making a huge difference in the lives of countless individuals. It's less invasive, has a faster recovery time, and can achieve outcomes that are as good as or even better than traditional surgery. And as research and innovation continue to advance, we can expect even more incredible things from TAVR in the years to come.
It's amazing to see how far medical technology has come. TAVR is truly a shining example of how innovation can improve lives. I hope this deep dive has been informative and insightful for our listener. And remember, knowledge is power. The more you understand about advancements in healthcare, the better equipped you are to make informed decisions about your own well-being.
Couldn't have said it better myself.
That's it for our deep dive into the world of KVR. Thanks for joining us.